Hi, my name is Juan. I'm a recruiter here at Mediscan Therapy Services. I'm here with Eileen McCabe, speech-language pathologist, and today we're going to cover some caseload management questions for speech-language pathologists.
Great. And I'm Eileen McCabe, speech therapist for our Santa Monica, Malibu School District.
Great. So thanks for joining us today. So in terms of caseload management, how would you schedule your students? How do you decide how to group them?
I schedule my students depending on whether they get individual therapy or group therapy. I schedule them by their disorder, if they're articulation versus language disorder, by their age. If they're preschool, of course I stay in preschool. I try and get kindergarten, first grade, stay around there. And I would never put an older child with a younger child. So, and their goals is huge. So you can manage your time that way and make sure you can all work on one lesson together and you're meeting all their goals.
What are some of the legal demands and time constraints of being a speech therapist?
Legal demands, I think, are the biggest part of our job. You have to make sure you're staying in timelines. You have timelines for your 60 days for assessment, you have 30-day assessments, you have 15 days once you get to give an assessment plan to get it back, and all of this once you get a referral. Those are huge because you want to make sure you're legally following the rules and that you're staying within timelines. That is a huge part of how I schedule my students to make sure I have assessment time and everything. So legal demands are really a big deal.
What do you think is the most challenging aspect of being a school speech-language pathologist?
The most challenging aspect, and I love my job, there are a lot, definitely scheduling. Scheduling is a puzzle and it's going to change throughout the year. You have to learn to be flexible. If sometimes teachers can't help it, there are time changes and you don't want the kids to miss out. So you're going to have to move a group, but then that means you have to move another group to get them in there. That's huge. Following these legal mandates where we have to follow timelines. Also, we have to only qualify kids depending on a specific level of where they're performing. If they're the 7th percentile or lower, or with articulation, how unintelligible are they, or are they developmentally appropriate sounds and all of that. It's just hard to always feel like I'm in a box and I can only move so far, even though I want to be helping every kid. You can't always do that, and with scheduling you have to figure all of that out. So you feel like you're being pulled in all different directions, but being organized helps that the most.
How does your ability to manage your caseload impact you professionally and personally?
Like I was just saying, being organized is huge. You want to be a good speech therapist and you want to do good therapy, so you don't want to always be thinking, I could be assessing this kid, or I have a meeting later today, or I can't believe I'm so busy I can't even focus on the group I'm with right now. I'm so burnt out I can't even do therapy. Which I want to be the best speech therapist I can be, and I want to be meeting these goals and helping these students. So making sure that you have a good schedule and organization and knowing when you need to assess and having times to have those assessments done, and knowing when you come in on Monday that you're going to be organized for the week is a huge part, because that way you can go into these groups with those kids and not feel overwhelmed and work with them and actually do the therapy you want to do, or being prepared before you come in. This is what I'm going to do with these students today, instead of just going on the fly, which we all do, and I do it. And it's hard not to always feel overwhelmed, but the longer I've been a speech therapist, the easier it gets, and to be organized is huge.
How do you track data for quick progress reporting?
And that's another huge thing, to be organized by tracking your data. So sometimes I take daily data. Sometimes I can just take quick data at the end of a session. I say, okay, that child was around 40% or 60% accuracy, and I write that down. Other days I actually take my plus or minus, or that was prompted, or this was imitated, or whatever it is, and that way I have a concrete, instead of saying 60%, it's 62%. But I keep that in a binder with all my students, all in one binder, so that when I'm doing progress reports, I can just open my binder and flip through per student and just type it in for progress reports, so that I don't have to take forever to think, what was this kid? And go here to pull that out and here to pull that out. It's all right in front of me, and I just flip through and I do it.
How do you use your SLIPA?
I use my SLIPA, my assistant, for therapy for sure, and I make sure to use him so I have assessment time and I have time to write reports. Not everyone has a SLIPA. I am lucky enough to have one. I still have a pretty large caseload, and I have a lot of individual therapy sessions. Sometimes, of course, I need him on a day where we both see kids all day doubled up, and I make sure that he's not in the therapy room same time as me. He'll be off in a preschool or pushing into a room or whatever he's doing. He is huge for my success. If I didn't have him, it would be really hard to have time to do my assessments or write reports. I would be seeing kids all day. I just make sure that I use him at times where I know kids are going to be available. They're not at recess. They're not at lunch, which is impossible to have that for everyone, but a good chunk of time where you know most kids are available is where I really put him in. And I don't have to worry about him because he's really good at therapy, so I'm not worrying in the back of my mind, is he doing good therapy? Is he taking data? I know that he's doing all of that because I made sure he was doing it in the beginning of the year by training him.
Tell us about the importance of cultivating relationships at a school site with other professionals.
It is so important to be a team with not just the special ed, but also with the general ed and your administrators, your principal, your vice principal, the people in the front office. I make sure that everybody knows who I am, the reading teacher even. Just make sure that everybody knows who I am so that I can best help the kids. So if the kids are getting occupational therapy or physical therapy, I talk with those specialists and I say, hey, while you're in this is my goals if you ever want to just, throw it in, and I do the same for them. It's huge, too, with the teachers. I'm always on the same page with the, we call it SAI teacher, but the resource teacher, the special ed teacher, to make sure that they're following through with what I'm working on to help generalize, which they normally are. I have a very good team, and we're very close, and we talk constantly about our students. And then just the other day, I had a teacher ask me, I can't get this student to answer questions, so I gave her some strategies. I make sure that general ed teachers know who I am, so if they ever have referrals or questions, that they can come to me. And then also with the special ed team, the school psychologists and the OT and PT, and the teachers, general ed teachers, the special ed teachers, we get together once a week for an hour and a half meeting. We make sure it's a time where all of our assistants can be helping and seeing kids, and we get together and we can talk about our caseload and our students and any issues we're having and how we can fix them. So it's just so important to be a united team.
What do you think of developing and teaching home practice programs?
Home practice programs can be so useful for parents, for them to be able to generalize at home. If the kids are always working on it, it's going to make my goals go faster. So I don't have any huge programs that I do for parents, but it is nice to have a few worksheets here or there, say, oh, you can work at this, and I send work home with kids. Or having 5 minutes at the end of the day for a parent to come in and say, this is what I'm doing, can you do this at home? Or if it's even like a half an hour of training a parent how to do AAC in some way. I have a lot of kids who have iPads, and they use Proloquo, so teaching a parent to do that, or giving them a checklist, to say what you did at home last night so I can help the kid talk to his peers, or We use PECS, Picture Exchange Communication System. I taught parents recently how to use that and how they can do it at home so that it helps generalize. Of course, you don't want to spend so much of your time preparing all these things, but in the end, if parents are doing it at home, it really does make your job easier. So spending 10 minutes to prepare something or have a meeting really does help.
What do you do when you already have a large caseload and teachers keep making referrals?
And that can happen, and some teachers will just refer without talking to you or anything, and they just give you these referrals. What I made sure to do in the beginning of every school year is when we're having meetings before the students are there, I talk to all the teachers and I say, if you need to refer anyone, please come to me first if you have questions about developmental sounds for articulation, or a child's not following the directions, or they don't seem to be following conversations well, or they're just socially not talking to anyone, they're in their own world. Those are all important things, but sometimes teachers don't know, and sometimes they're holding kids back because they don't want to refer them, but other times they're referring them all the time. So if teachers have a little basis of what a speech pathologist does, which I usually tell them, they have a better idea about who they're going to refer. And I've actually, in the last 2 years, not had any teachers refer without talking to me first. I've talked to them all enough, and they all know me enough, and I say, how's your school year going? Do you think you need anyone that needs me or needs my help? And then they give the referrals. I usually also send an email out in the beginning of the year saying, these are where the speech referrals are, but please talk to me first if you have a question, so I can help you fill out the referral and whether it's necessary or not.
How do you advocate for yourself when you feel overwhelmed?
And you can feel very overwhelmed in this job. I advocate for myself by talking to my supervisor first. If I feel overwhelmed, saying, this is too much, I need help. They can't always help you right away. They don't always have the people to give to you to help you. But they are the first one I think you should go to. And if they can't help you, they can have ideas on how to help you. And just asking other speech therapists or other specialists or other teachers to get ideas, or say, do you have an idea how I can do this, so to help you a little bit more. When I first started, I had a lot of kids, the large caseload, and a lot of them were individual therapy. And so I said, I really need my SLPA every day. And so they listened to me and they gave it to me. And the other speech therapists in the district knew that I needed him. So they said, because we split him between schools, we have a few, but we split them between schools, and they said, okay, we understand you need him. We'll make do. You take him. So just talking to other speech therapists or to your supervisor or to the other teachers, somebody might have an idea for you. So I think advocating for yourself is talking to people and figuring it out, and also being organized helps a lot. I feel like that has really helped me. That way, if I am organized, I say, see, I have all this here, and I'm still drowning. 'Cause you helped me, and having that was easy, and that's why I got the SLPA, because I had that organization. They were like, okay, you're right, we'll get you somebody. And that's how advocating for yourself can help.
Well, thank you so much for all your time today and for coming in and sharing these caseload management tips with us. Mm-hmm. We definitely appreciate it, and thank you for your time.
Absolutely, and I hope I could have helped somebody with all that.